What is the prevalence of frequent mental distress among adults with disabilities living in the United States? What impact does this have on healthcare access, and what can be done about it? Frequent mental distress is a term that describes the experience of having poor mental health for 14 or more days of the month. Data has shown that individuals with disabilities experience frequent mental distress significantly more often than those without. Among people with disabilities, rates of frequent mental distress were similar across states, gender, and urbanicity. However, the rates of frequent mental distress differed across age groups. Adults aged 65 and older were the least likely to experience frequent mental distress, while individuals aged 18 to 44 were the most likely to. In terms of healthcare, data showed that the majority of adults with disabilities had insurance and at least one personal care provider. However, those without insurance or a personal care provider had increased rates of frequent mental distress. Individuals who struggled to afford healthcare expenses were also more likely to experience frequent mental distress. Seeking routine doctor checkups was associated with a lower likelihood of frequent mental distress. So, what changes can be made to help support people with disabilities experiencing mental health distress? How can we create a more inclusive and accessible system? First, individuals experiencing frequent mental distress may need additional supports to access healthcare and engage in healthy behaviors, as mental distress can often make it more difficult to engage in self-care behaviors. Additionally, more can be done to provide affordable services to people with disabilities through subsidizing healthcare costs and reducing insurance-related barriers to accessing mental health care. Continued research on frequent mental distress among people with disabilities and specific reasons why younger individuals are more likely to experience poor mental health would allow for more targeted solutions. Data used in this project was from the CDC's Behavioral Risk Factor Surveillance System surveys. More information about this project can be found on Utah State University's Institute for Disability Research, Policy, and Practice website. This project is supported by the Centers for Disease Control and Prevention of the U.S. Department of Health and Human Services, or HHS, as part of a financial assistance award totaling $900,000, with 100% funded by the CDC and HHS. Funding is facilitated by the Association of State and Territorial Health Officials and the Association of University Centers on Disabilities.